Hey, let's talk about peptides. What are they? How are they used? And do they really work? So, what are peptides? You've been hearing about peptides. A lot of people in Hollywood use them, athletes use them. But what are they using for? And are they safe? Are they FDA approved? First of all, what are they? Think about peptides as short chain of amino acids. Amino acids are the building blocks of protein. So I'm going to give you an example. The teacher and me, when I work with patients, I create stories for them so they remember that. So think about them as this is amino acids. So short chain, this would be a short chain of amino acid. That could be considered a peptide. Now, something long, these are also amino acids, and they're a long chain of amino acids, typically 50 or more. Those are called your proteins. So how do they work? Peptides are super specific, and how they work, I kind of consider them as very specific text messages. Instead of going to the group chat, they're very specific. Hey, John, pick up the trash. Hey, Mary, remember to cook chicken for dinner. They're very, very, very specific. So it can get very confusing when you start working with peptides, you're really interested in it. It's kind of like vitamins, they are categorized for their different effects and how they impact the body. So let's kind of categorize them like vitamins. For instance, a lot of people use vitamin D, vitamin C, and zinc to boost their immunity. A lot of people use vitamin B12 in order to help with their energy. And some other people will use something like ashwagandha, even though it's not a vitamin, it's actually an herb, to help them with like adrenal issues and they're feeling like overstimulated or even sometimes just like tired and no energy. So when you look at these peptides, the most famous one you probably heard of by now, and is the GLP peptides, specifically semaglutide and tirzepatide. Why are they so popular? It's because they are very effective. So how they work is they actually calm down that food noise, of always being hungry, thinking about, I want to eat. What am I going to eat? When can I eat? So it really calms that food noise down. So it also helps with insulin sensitivity. Therefore, you're not constantly craving food. So when they work together, guess what happens? You're going to eat less and you're also going to have weight loss. So that is, those are some of the ones that a lot of women use and men for fat loss and for weight loss, and they have to be done properly, which I'm going to share at the end of this video. Number 2, this is primarily used for the guys, the dudes that are the bro science online, is BPC 157. So BPC 157 works a lot for people take them for inflammation, for muscle injuries, for tendon issues, injuries sustained as a result of working out, athletes out in the field. These are commonly used for those issues. The BPC 157 is called body protective compound and also made from gastric juices, human gastric juices. Therefore, in addition to helping with the inflammatory process and the healing process and the recovery because of something called angiogenesis, which just means the formation of new blood vessels to the area so that it can get what it needs to fix it quicker. It also works great orally for gut health. For a lot of people that have gut issues, whether they have like leaky gut is a very popular one that's used. So you've got BPC 157. So also great muscle and for gut issues. Number 3 is something called TB500. So TB500 also works for inflammation, also works for a lot of muscle and tendon issues, bone issues, because it works with something called actin, and it actually gets to the site quicker that needs to be repaired. It's basically telling the cells, get over here, we need to fix this area. So when you actually team them up together, I like to call them the Batman and Robin, the dynamic duo, also known as the Wolverine stack. So that's number 4. The Wolverine stack, when these two work together, they work amazing because you kind of have like Batman. He's like BPC 157 is the star, okay? He's the Batman that he fixes things. Robin is a little smaller, so Robin is just very specific and say, hey, there's a problem here, here, get to this area quickly. So when they work together, they're that dynamic duo, they're that Wolverine stack that a lot of athletes, a lot of actors use for recovery after doing stunt work and just all that wear and tear on their body. So it works beautifully. And then 5, I got one more, ladies. Now, there's so many peptides out there, but I want to just kind of give you a few that you've probably heard of, is GHKCU, which is a copper peptide that helps for the formation of collagen, therefore healthier hair, great skin, and is actually used for tissue repair as well. So when you actually add that and stack it, add it to the Wolverine stack, which is the BPC 157 plus the TB 500. So 1 and 1, or when you add them together, that's the Wolverine stack. When you add the GHKCU, this is also known as the glow stack. So imagine how they work together. So what else do you need to know? How do you take them? Well, most of them are injectable, so therefore injectable wellness is a new term you're going to see floating around. The best one that works orally that I have seen is BPC 157. Are they safe? Some of them are FDA approved, not all of them are FDA approved, and some of them are actually banned for the use of some athletes because they work that great. So you've got to work with a provider in order to use peptides correctly so that you don't get any side effects, although I haven't seen really any side effects other than people that inject it in the injection site might get a little bit of redness, it's irritating. But once again, this is something that you have to work with your practitioner, your healthcare provider, because they are very personalized. Where do I get them? Well, you can get them online. I'm not telling you to get them online, but you've got to be careful of your sources. It's kind of like when patients come to see me. They're like, hey, I'm taking some fish oils. And I'm like, okay, where did you get them? Oh, I got them at Costco. I got them at CVS. I picked them up at a generic health food store. Well, the quality is usually not as good as what I've seen in all the years of practicing that in what we work with our patients. We get everything that's just for professional use only and for practitioner use only. So just saying that, be very mindful if you are thinking about using peptides. What else did I want to cover? Oh, do they really work? Just like anything, just because you have a gym membership doesn't mean that you're going to get the body you want unless you go to the gym. When I work with patients, I tell them that you have to do the lifestyle changes and the foundational work. Peptides are kind of like wax on a car. You got to wash the car, and what I equate washing the car to is exercise, getting your sleep dialed in, eating a good diet, meaning excluding your alcohol, your sugars, your inflammatory grains, drinking enough water. So you have to do the exercise, the diet, and number 3, you got to get your sleep dialed in. You can't be going to bed at 12 o'clock at night, midnight, 1 o'clock in the morning, because a lot of healing and recovery happens a couple hours before midnight. So you got to get your sleep dialed in. You got to get your stress dialed in as well. Have stress management strategies, and you've got to have number 5, accountability. That's where you have to work with a professional, because you just can't take these. Sure, as I mentioned before, you can go online, order them, and then try to figure out, well, how am I going to dose this? Okay, I'm just going to go and chat GPT it, But once again, you've got to work with what works with your body. Just like gas in a little car compared to gas in a high-end larger car, they both have different protocols, I guess you could say, because one needs more gas, other one doesn't. One is more efficient, the other one isn't. So think about them as your kind of the same way. So once again, peptides are short chain amino acids. There's a lot of them out there. Not all of them have been FDA approved. Some of them have. Oh, there's one of my favorite. I'll share in another video that's specific for fat lipolysis, for just breaking down that visceral fat. That one is an FDA approved one. So, but once again, you got to work with your practitioner. So there you go. That's what peptides are, how they work, whether they're safe or not, and where you can get them.